Hi, I'm Dr. Singhania from Singhania Clinic, and I'm going to talk to you about signs of ADHD. Attention deficit disorder has been recorded since 1901 in fact, the first paper was written by Dr. Still, ironically, where he described 12 children who are very hyperactive and difficult. We do know that ADHD has a very strong genetic component, but as all neurodevelopmental problems, it is epigenetic and environmental factors can affect it. So if a child is exposed to mercury or lead in early life, mercury in the mother's womb, or the child has zinc and iron deficiency. In fact, anemic children can be very restless and inattentive. Any early psychosocial stress, especially toxic stress, can give rise to symptoms of ADHD. It must be remembered that ADHD is a complex disorder and a chameleon disorder. It can present itself in many different ways. Your child may present with academic problems. For example, a child who has dyslexia or reading difficulties may also have ADHD. We know that 80% of children with learning difficulties have ADD, whilst 30% of children with ADD may have learning difficulties. The child with ADHD may present with behavior problems, especially the younger they are, the more difficult they can be, or restless. And of course, in teen years, when they become defiant and rebellious. An ADD child may present with emotional problems. A child suffering from OCD, for example, obsessive compulsive disorder, or depression may have underlying ADHD or ADD. I want to talk about two cases just to present the different ways in which ADD and ADHD can present. Reem was a 15-year-old girl. In her own country, in elementary school, she was very intelligent, she was very talkative, but the teachers allowed all that because she was very bright and did her work. She was slow to complete her tasks, but she managed and in fact got A's in her elementary school. When she moved countries, she moved schools, she became tardy, she became withdrawn, moody, and her academic grades deteriorated. And in contrast, there is Amit, a 5-year-old boy who's very social, cannot sit still, is very fidgety. He was late to talk because ADHD can affect a child's ability to learn language, and he started talking well only after the age of 4 years. In class, he was aggressive and disruptive. So you can see both these children are showing signs and symptoms of ADHD, ADD, and you can wonder how two very disparate children can have the same diagnosis. But as I've mentioned in my previous slides, ADHD is very complex. It's clouded by comorbid conditions, by learning problems, by the age of the child. It can be a lifelong disorder and it can present in many different ways. So just to reiterate, ADHD is a chameleon disorder that can present in many different ways. Your child may be a very shy daydreamer who is like a wallflower in a classroom, or he or she may be a loud, boisterous, restless child who is disruptive. If you are seeking help, please visit our website www.singhaniaclinic.com or call us on the number shown below. Thank you for watching.